Now, after spending 6 years training in Russia, a group of medical students are among the growing list of unemployed graduates in South Africa. 38 graduates say the government has left them in the lurch. They were sent to study medicine at the Astrakhan State Medical University in Russia by the Free State Department of Education. They returned home in early August, and despite government's promise to pay for their Health Professionals Council of South Africa board exam fees, nothing has happened. For more on this, we are joined by Katlego Ditsoane, a medical studies graduate from the Free State. Katlego, thank you for joining us this evening. Now, your joy of being offered a scholarship to study medicine under the Russian Federation was short-lived as you faced numerous challenges while you were abroad. Just take us through the experience of studying there with the likes of COVID-19 having taken place while you were abroad.
Okay, thank you for having me, Katlego Ditsoane. Well, as you can imagine, when you get the news that you are awarded this prestigious, opportunity to study medicine, and then when you think that medicine in South Africa is one of the, it's topping the list of one of the critical skills, being part of that, it's really nice. And then back in 2016, when we heard this news, we were obviously excited, and then we signed our contracts and then went to study abroad. Yeah, and then let me just clearly just correct you a bit there. From the Free State, there's like 46 of us. We are different from the 38 graduates are from Mpumalanga, but us, we are from the Free State. So all in all together, we are 84 sitting at home unemployed. And then after being promised that we will be integrated like the Cubans, and then we will be working in no time. So that's the reality of the situation. And then the COVID, for me, most of the COVID, I spent it at home because I had to come back home because I was ill that side. But then it was really, really a difficult time because even that year when COVID hit, we were supposed to come back here for our annual holidays. So it didn't happen because of those flight restrictions. So you can imagine being far from home, and then now there's a pandemic, so you really don't know what tomorrow has in store for us. So it was really...
All right, it seems as though the line to you there, Katlego, is not quite clear. If you're back with us, please can you continue?
Yes. I am not sure where the line really
had an issue. Yes, so you were explaining that with the likes of COVID-19, you were unable to continue, but you were then just giving us some of the challenges that you experienced abroad with other medical students while you were studying in Russia.
All right, with studying, like COVID really impacted a lot of disciplines. We had to move like classes to online, and you can imagine, doing medicine. Medicine is a very practical profession, so you have to be in the hospital to do most of the stuff. So now moving it to online, so it kind of becomes a theory-based type of profession. So now it really adds more on the lacking in the clinical aspect. So meaning now we lack the clinical skill, but then the theory part we are really, we have been really sharpened.
Okay, so you've sharpened the theory of this, and now after 6 years of studying, you're now back home, and you're still not registered with the Health Professionals Council of South Africa. Why is that?
All right. When we were starting this program, we never knew of the HPCSA. We were never told that we'll have to come back home to have to write the board exam or to do. We were told that we are going to do the integration program like the Cubans. The Cubans, they don't have to write the board exam. They don't have to do this for foreign qualified doctors. When you come back to South Africa, there's an organization where you have to. It's called ECFMG. That's the primary source verification for HPCSA. Before you register with HPCSA, you have to send your documents to the ECFMG, and then they verify them with your university and send the report to HPCSA. So the process is a very tedious one and expensive one at that. So the problem was the government were reluctant in paying for us that. So we had to use our own fees to pay for the ECFMG. So a lot of students are still stuck in that process. So before you get registered with the HPCS, you have to pass that process. So that's why we are still at home and we don't even know when we'll write the board exam.
So, Katlego, I just want to understand what the communication was between government and the students upon getting the scholarships when you guys went to Russia. And, I mean, you were promised that you'd be absorbed back into the system, meaning that you'd be able to then practice as doctors in South Africa, because my understanding is that because of the scarce skills that we have with the shortage of doctors in the country, hence we're absorbing doctors from Cuba, you guys were sent there to go study using government funds for you to be able to come back and give back to the government. So where was the disconnect in terms of not knowing who needs to pay for these board fees with the Health Professionals Council that you guys now needed to register with that, and now having you guys sit at home and not do anything and, I mean, be unemployed?
Okay, it seems like the National Department of Health and the HPCSA as the statutory board, they were not included in when this scholarship was being formed. They were not included in the decision making, because had they been included, we would have known beforehand that these Russian universities that we are going to, they are non-exam, they are exempt-track universities, meaning that you'll have to write a board exam when you come back home. So when we went to sign the contracts, we were told that, after 5 years of studying in Russia, you will then be brought back home to be integrated like the Cuban students are doing. But now here's the tricky part. Then in 2016, when we were signing the contracts, the scholarship was under the Department of Education. And then in 2018, when they were changing the premier, when the new premier of the Free State assumed office, this scholarship was then transferred to the Department of Health. So now when we got to the Department of Health, that's when we learned that and we'll have to register with them. And also after registering with them, doesn't mean that we'll come back at home as interns. We'll have to do the board exam. So now the board exam is separated into two parts. There's the theory part and then there's the practical part. But then having studied in Russia, and the language barrier between us and the patients back home, it makes our clinical skills a bit weak as compared to when we were studying here in South Africa. So now we are facing this board exam, and then the governments, both in Mpumalanga and Free State, they are not actually willing to help us find a suitable program to train us clinically.
So, Katlego, I mean, with what you've already studied so far in the 6 years that you spent in Russia, and you've explained extensively that you did a lot of theory, what jobs can you do now while in South Africa?
You can't really do anything. Me and other colleagues, we tried applying for administrative jobs at the surgeries, but none of those people are willing to take it, because it's a bit weird now. You have a doctor applying for an administrative job to be basically a receptionist. So no one will hire you with your medical degree, because it spells confusion. You studied medicine, why are you now applying?
So, I mean, Katlego, in the 6 years that you've spent in Russia, is the government then saying that this 6 years was just a waste of time? I mean, what's their response to this? And what way forward are you getting as these 84 students that are sitting unemployed with medical theory?
We've been trying to organize meetings with them. They've promised to meet with us, but that was 2 weeks back. Nothing ever since.
Sure. All right. This is a story that surely needs some follow-up on. Thank you so much for joining us this evening. Quite troubling to know that students traveled abroad, used government funds for 6 years and studied medicine, and yet are sitting homeless and contributing to the numbers of those unemployed. That was medical student and graduate Katlego Ditsoane, who is a representative of those students from the Free State. Now